definition. Fox 19 News Morning Extra.
And welcome back to the Morning X. Hundreds of thousands a year are flocking to surgery centers across the country and the world. They're looking for that new look, that perfect fix, you know, a little nip here, a little tuck there. We've heard the horror stories and we've seen some of the pictures. So how do you find the perfect surgeon for you? Dr. Jean Ireland with the Plastic Surgery Group joins us with some advice. Good morning.
Good morning.
Okay, so where do we begin?
Well, I think the bottom line, we'll start at the bottom line,
Okay, yes.
and that is you want to go with somebody that has the most experience and expertise.
Okay.
And where you start is an organization called the American Board of Plastic Surgery. This organization is like the American Board of Neurosurgery, Orthopedics. It's sanctioned by an organization, the Medical Board of Medical Examiners, or the National Board of Medical Examiners, and they really certify the neurosurgeons, the orthopedic surgeons, the internal medicine specialists.
So we go in there and, I mean, literally you can put in your area and they will list doctors and that's where you start?
And the individuals across the country in multiple specialties that have been certified by the American Board of have met 5, 6, 7 years of training in plastic surgery. It's 5 years of training at least, 3 years of general surgery, 2 years of residency in plastic surgery.
Because we've all heard the horror stories, we've all seen the pictures, and so we want to make sure that we're at least moving in the right direction.
Right,
so that's
and
the best
so
place
step
to
number
begin.
one is expertise and experience.
Okay, wonderful. Well, that's some good advice. Let's take a look at some pictures.
Okay.
Some before and after, because these are absolutely amazing. The first, a facelift. Talk us through.
Okay, the original pictures are all on the left side, and if you look at the top left, there's a little extra tissue along the jowl, and if you look at the profile, there's some extra tissue underneath the chin. And if you move to the right, in the post-operative pictures, a number of things have changed. There's more fullness in the cheeks if you're looking at the front view, and usually in order to make a facelift patient look natural, which is very important, there needs to be more fullness in that cheek area. So as you come down from the cheek, it's been augmented or puffed up a bit, and the jowl area has been decreased.
Yeah, she looks amazing. Let's move on to our next set of pictures for the lower body lift. When can you expect to see some changes? Pretty quickly
about the time the surgery is over with.
Really? Okay, that's amazing.
It's kind of pretty instant. If you look at the pictures on the left, in the front view, there's kind of a crease around where the belly button should be, and then there's a fold of tissue, or a panniculus it's called, and from the side view you can see this apron of skin hanging over. In the after view, the surgery has gone all the way around. So not only is the buttock area gone up, but the tummy has gone down.
Let's quickly move on. We just have a few seconds. I do want to show the eye lift and then move on to the chin augmentation. So the eye lift, that is amazing from the before and after, and then let's move on to the chin augmentation.
And the classic Andy Gump look. When you augment or build onto the chin, it could be done a lot of different ways, but the simplest way is just to put a little piece of silastic or silicone behind the soft tissues, and in 30-40 minute procedure, you've got a chin.
Wow. Thanks for leading us and guiding us in the right direction.
You're welcome.
Good to see some pictures before and after. Nice to meet you, Dr. Ireland.
Likewise.
Okay.
In high definition. Fox 19 News Morning Extra.
All right, Frank, thanks so much. Well, millions seek plastic surgeons each year for a little nip and tuck here and there to make them feel and look a little better. This morning, plastic surgery after major weight loss. From the Plastic Surgery Group, Dr. Michael Ledbetter. Good morning. Good to see you. First, I must ask you, how does someone find the right plastic surgeon for them?
I think the important thing when you're choosing a surgeon of any type is that the surgeon's board certified in their specialty. The easiest way for a plastic surgeon to find a plastic surgeon is to go to the website for the American Society of Plastic Surgery, and all board certified physicians will be listed there in the different areas of the country. And the other way to find a good surgeon is to talk to your family physician. Most family physicians know who the better surgeons are, and they'll refer you there.
All right, great advice. Today we're talking about after major weight loss, kind of helping the body get back into place, and so plastic surgery after that. Let's take a look at some pictures. Now, is this a one-time surgery deal, or how does this work?
What you're seeing right there is a one-time surgery situation. This is a woman who has lost a lot of weight. She has a very heavy upper arm and a lot of laxity of skin. So in her case, we're helping her to recontour her arm so that she can fit her clothes better, feel better about herself, and get over the changes that have occurred because of her massive weight loss.
Okay, let's take a look at our next group of pictures.
This is a similar situation. This is what we call an upper body, lower body disproportion. And in this person's case, you can see they have extremely heavy abdominal tissue. They've lost a lot of weight, their skin has relaxed, they have a lot of problems with contouring their clothing. And in this case, we do what's called a lower body lift, where we make, or a circumferential abdominoplasty, where we make an incision all the way around the body. It's sort of like a little person in a big pair of pants. What we're doing is we're contouring the pants to their new body. And that's what we've done in this.
Is this something that you do in one surgery?
This can be done in one surgery.
So
yes.
What's recovery like after a...
Most recovery at this time, I tell most people that if everything goes well and there's no healing difficulties of any sort, it's going to take about 6 weeks for them to get back into their regular routine. And each week they're going to get more active. They're up and around right away, but you know, obviously they have to limit their activities until the healing takes place.
Is this outpatient surgery?
No, these are usually, lower body lifts are usually done as an overnight stay in the hospital, 1 to 2 days, and then usually home.
Okay, I think we have one more group of pictures to look at.
Yeah, this is a more limited type of an abdominoplasty, and this is a person that has a more difficult problem. This is a person, if you look in the center of the preoperative photograph, they have a large abdominal hernia. So we do a lot of reconstructive work when we also do body contouring, because they've lost contour of their abdomen. They may have a hole in the abdominal tissue. They may have extreme weakness to their abdominal muscle. And in this case, we've not only repaired their profile, but we've repaired the strength of their abdomen. So in this case, we've repaired the hernia, and we've also contoured their body.
What price range are we looking at for something like this?
It varies depending on what you do. It can be anywhere from $5,000 to $15,000 depending on what you have to do. And these are staged procedures. A lot of people don't realize that we see a lot of people after gastric bypass today, and they feel the gastric bypass is a big operation, which it is. But the body contouring portion of their reconstruction can actually be much bigger, because you're dealing with a lot larger areas, a lot more potential for blood loss and things like that. So it's really a procedure that takes a lot of planning and a lot of safety.
Wow. Doctor, thank you so much.
You're welcome.
Stay with us. More on the X in just a moment.
In high definition, Fox 19 News Morning Extra.
Welcome back to the Morning X. When you hear the term plastic surgery, what comes to mind? Cosmetic, doing what you can to look younger. In fact, for many, plastic surgery can be just the opposite. Dr. Vesey's expertise is to help after accidents and illnesses. He really does all the above, but welcome to the Morning X. That's what we're talking about this morning. And it's fascinating, because I think most people do, when they think of plastic surgery, they think of making ourselves a little bit better or younger or so and so forth. But in fact, a lot of what you do is to help people.
Right.
Yes. Can you talk a little bit about reconstructive surgery?
Yeah, I mean, the whole term is plastic and reconstructive surgery. So every plastic surgeon is trained with a broad foundation in reconstructive surgery. Cosmetic surgery is one part of the whole spectrum. So the plastic surgeon's job is to take what the patient has and use that to make them better or to reconstruct what they're missing.
And what are some of the patients, the difference between cosmetic and reconstructive? I mean, you're seeing a totally different patient when you're doing reconstructive surgery.
Right. When you have a cosmetic patient, you're taking someone who already looks good and you're trying to make them look better. When you have a reconstructive patient, you have a patient who's missing something or has a deficit, some functional deficit, and you're trying to bring back that function either by reconstructing it with some part of their body or by using some prosthetic portion.
Dr. Vesey, when a patient is seeking a plastic surgeon for reconstructive surgery, are they looking for a different doctor than if they were looking for someone to do cosmetic surgery? And how do they go about doing that and finding the right person for them?
I think the patient always has the right to ask the physician or the surgeon what their training is or what surgeries they do, or to see pictures, or to possibly even speak to other of their patients. But most plastic surgeons are trained in all of the areas of plastic surgery, including reconstruction. So it's kind of the patient's job, and ask their doctor what they think, and if the doctor is comfortable doing it, they should be able to tell them.
I can only imagine some of the cases that you've had. What about some of the patients that come in that need reconstructive surgery? may not have the insurance or the funds to pay for that. Where do they turn for help?
A lot of times, specifically with breast cancer and breast reconstruction, most cities have some sort of funding for that. And if a patient has breast cancer, there are ways to provide them funding, both for their cancer treatment and for their reconstruction as well.
So in seeking a doctor, maybe that's a good question for the patient is, I need this done. Maybe it's something that visually that we can see that they need some reconstructive surgery. But to say to the doctor, I don't have the funds to do that, can you help? Can doctors do that? Are offices equipped to help them?
There are people in just about every office that can help a patient find areas or find places of funding.
Okay, before we go, what advice do you give to someone looking for that perfect plastic surgeon? Where do they go?
The internet is always good. There are plastic surgery websites, the American Society of Plastic Surgeons, abbreviated ASPS. You can go on there and you can always check out your plastic surgeon there. That's for every plastic surgeon in the country, and if that plastic surgeon is not on that website, then they're not the right plastic surgeon for you.
That's a perfect note to end on. And so thank you very much. I appreciate you joining us. And of course, if you want more information on Dr. Vashi and his group, the plastic surgery group, you can go to our website, fox19.com, click on the big red box, today's date, and we'll link you to his website. Thanks so much.
Thank you.
In high definition, Fox 19 News Morning Extra.
And welcome back to the Morning X. How nice would it be not to have to grab for that eyeliner or lip liner or even eyebrow pencil, just to name a few. You can wake up looking like you've spent an hour already in front of your makeup mirror. It's called micropigmentation. Here to answer all the questions, registered nurse Carrie Sherfons. Carrie, good to see you.
Good morning, Tracy.
Okay, and those are just some of the few, but explain to our viewers what micropigmentation is.
Okay, micropigmentation is actually the microinsertion of pigment into the skin, depending on the area that the color is desired, whether it be brow color, eyeliner, or lip color. There's other treatments that we do, scar camouflage. And
so it's not just for cosmetic reasons. I mean, there are other reasons that you do it, and we'll get to those in just a second. But is this something that's been around for a while?
It actually has.
Okay.
I've been personally doing it for a little over 8 years, and it's becoming more popular. Once somebody knows that it's actually a treatment that exists, it's hard to pass by.
Well, for cosmetic reasons, it sounds really nice to wake up in the morning and already be ready to go, you know, not to have to stand in front of the mirror. So let's take a look at some of the pictures because we have some before and after. The first one is the permanent eyeliner. How long of a process is this? Something that's done in the office, or is this outpatient?
It is done in the office.
Okay.
And actually, the treatment lasts, you're in the office about an hour and a half.
Okay.
And you're walking away with a little bit of swelling along the lash line that lasts, it depends on how you heal, but it should last around 12 hours, 6 to 12 hours.
And when we say permanent, is this forever, or is there some touch-up that needs to be done down the road?
That's a great question. It is the sun that over time softens the color as well your skin's metabolism of the color. It should last 8 to 10 years depending on how well you take care of your skin.
And what would something like this cost?
You're looking roughly around $400 to $600.
Okay, let's take another one. I think lip liner is our next one. Yeah, this is the difference. Wow, that's amazing.
It is. Actually, what's really nice about the permanent makeup, it can be applied however soft or as concentrated as you would like. What's nice about permanent makeup is once it's applied, you can still put your glosses on or your makeup over top of it. It's just really nice that when your makeup goes away, you cleanse your skin, that you're left with makeup there. So
that is nice. And what would something like this cost?
The lip color is $600.
Okay, and let's take a look at the brow. We have before and after pictures of this as well. That is really nice as well.
The brows are very popular. Anyone who is reaching for a brow pencil to apply color, you're a great candidate. It's always nice that the color's there and you're not worrying about the color being smudged. It's definitely the color of choice is dependent upon the patient's skin tone, hair color.
And obviously you help them make that choice.
Yes.
Is the process in applying, is it similar to getting a tattoo?
It is very similar. Probably a little bit of a difference for the medical field. We do apply lidocaine, whether it be a numbing agent like a cream or the actual injection to numb the skin. The machine that we use is a lightweight pencil-like machine, and that might be a little bit different than your tattoo artist.
Okay, and what is the downtime in getting something like this done?
Depending on the swelling that you incur, that can last about 24 to 48 hours.
Okay, so you just need a couple of days then.
That's it.
Carrie, thank you so much.
Thank you, Tracy.
It was very interesting.
high definition. Fox 19 News Morning Extra.
And welcome back to the Morning X. Over 300,000 women had breast augmentation surgery last year. The procedure has changed over the years. The newest, leaving you scar-free. Here with all the details from the Plastic Surgery Group, Dr. Williams. Welcome to the Morning X. Good to see you.
Thanks for having me.
Okay, so tell us about this procedure. And you said it's not relatively new.
No. Over the last 10 or 15 years, plastic surgeons have been looking for procedures that we can do through smaller scars, less invasive, hopefully improving our results. There has been some application in facial cosmetic surgery with respect to endoscopic procedures. And breast augmentation similarly has enjoyed some popularity with endoscopic procedures. General surgeons and gynecologists typically have had a lot of notoriety about improving their results and offering the opportunity for patients to have, gallbladders and procedures such as that on an outpatient basis. So using those same instruments, we're able to provide, I think, a better experience for some of our procedures today.
And it is really interesting. If we could take a look at some of the pictures, we have some pictures up of 2 months post-op, 4 and 6, and by the time, and this is actually done under the arm.
That's correct. As you can see, this scar tends to be, it's well concealed, obviously, and there tends to be some interest in women who are good candidates for endoscopic procedures, obviously, to have this type of a scar. That's not to say that the scars on the breast that we have offered over the years with traditional breast augmentation are much more noticeable, but clearly this tends to be an advantage for many women.
Sure. And who is the best candidate for something like this, for this particular procedure?
Well, in my opinion, I think that women who have very good symmetry, very good balance to the breast, women who do not have developmental problems typically are great candidates for this procedure. Obviously, I'd like to see a patient be a good candidate for a saline breast augmentation as well. I think that the traditional incisions for silicone gel augmentation still are probably best utilized for gel augmentation.
Is the recovery time different than the traditional breast augmentation surgery that you're doing, or is it similar?
It's similar. I usually tell patients they're looking at about 2 to 3 days of pain pills and 2 to 3 days of getting off pain pills, so that by postoperative day 5 or 6, they're typically back to most of their activities of daily living. Not to say that there's not some soreness and discomfort that can occur with exercise and greater mobility, but clearly by postoperative day 5 or 6, they're doing pretty well.
Are there any additional risks in this particular procedure than others?
Not significantly. We obviously are looking at all of our breast augmentations in terms of the risks of not only scarring, but we're looking at risks of swelling and abnormal collections of blood and placement of the implants to be accurate and perfect. And so there really isn't a significant advantage with this approach. The approach basically offers us almost a scarless incision.
That's interesting. Thank you so much.
Okay.
Thanks, Dr. Williams.
Well, thanks for having us.